In this lecture, I'll discuss surgical blades. Let's understand this topic with the point that when the patient is in the surgical position and the surgeon is all set to start the surgery, so to start the surgery, we always make an incision, and for that the surgeon requires a blade, that is the surgical blade. So there are some important points which we need to discuss before going into the detail of the different types of surgical blades. The first point here is that the skin incision should be made with a scalpel, and the blade should be always placed at right angle or perpendicular to the skin, will create a clean incision. As if the incision made is oblique, in such cases, there will be necrosis of the undercut edges. Now, after that, a very important point you need to remember is that incision is always made from far end to the near from the surgeon, which means if you are a righty, you will start the incision from left side to the right side, and if you are a lefty, you will start the incision from right side to the left side of yours, okay, which automatically means that you will start from the far end to the near end. Okay, so do remember this point. And lastly, all the surgical blades and the scalpels should be passed in a kidney tray. Okay, it should always be passed in a kidney tray. And if the kidney tray is not there, always hold the blade towards your end and then pass the surgical blade to the surgeon or the nurse you are passing to. And another important point I want to mention, which usually students go wrong with, is that the sharpest portion of the blade is the belly of the blade. Yes, do remember this point, that the sharpest point is the belly of the blade. Now, after that, let's discuss the various surgical blades which are available, and these have been asked in the exam also, and this blade number 11 has been asked in the latest PG exam. So, let's discuss blade number 11. So, this has a sharp tip and this is known as stab blade. Okay, it is known as a stab blade, and as it has a sharp tip, it can be used for incision and drainage and also for arteriotomy. Okay, so this is the blade number 11. The other is the blade number 10. Now here I want to mention the other two blades also. Before discussing blade number 10, 12 and 15, I want to highlight a point that the blade number 10 and 15 have a belly, okay, while the blade number 12 has a curved margins. Okay, so starting with the blade number 10, as it has a belly like structure, it is used for skin incisions. But blade number 12, which has a curved margin inside, is used for suture removal. And do remember that blade number 12 can be a potent question for this year. After that, we'll move to blade number 15. So as I have just mentioned that it has a belly and a curved margin outside, and as it has a belly which is the sharpest point, it is used for making precise incision. Okay, as the blade number 15 is little smaller in size, they can be used for making precise incision. So the uses for blade number 15 is minor surgical procedures, the plastic surgery and in pediatric surgeries. After that, we will now discuss about blade number 20, 22 and 23. And all these three, as you can see, again have a belly and a curved edge. Okay, so we will start with the blade number 20. Now, blade number 20 is used in the orthopedic procedures. Okay, blade number 22, they have a large curved blade, as you can see in this image. So these are mainly used for cutting tissues, thoracotomy and laparotomy. And lastly, blade number 23 is leafed shaped blade, and these are used for making long and thick incisions and in the abdominal incisions. So these are the surgical blades and their uses